Hi there! It's me, Sam, your nurse on duty. Today, let's talk about how to manage a patient with cough, hemoptysis, and DVT, understanding medication priorities. A patient comes to you coughing up blood with leg swelling from a confirmed DVT. The doctor orders tranexamic acid to stop bleeding and Clexane to prevent clot extension. What could possibly go wrong? Always follow ABCs. First, hemoptysis threatens breathing. Immediate priority. DVT threatens circulation. Secondary but serious concern. Understand the medications. Tranexamic acid. Action is stops bleeding by preventing clot breakdown. Risk is promotes clot formation. Risk of DVT-PE worsening Clexane. Actions is prevents new clots, treats DVT-PE. Risk is risk of bleeding, especially if active hemoptysis. Why tranexamic acid and Clexane cannot be safely combined. Giving both may cause bleeding to worsen or clots to dislodge, risking pulmonary embolism or respiratory collapse. Keep in mind, you cannot stop a clot and prevent a clot at the same time. Choose based on what threatens life first. Now, in other scenario, if this patient's airway is stable but they have hemoptysis and a DVT, what would be your next step before giving any medication? Your management will be stabilize airway and breathing, conduct imaging, CT pulmonary angiogram to assess for PE. Withhold tranexamic acid unless massive, life-threatening bleeding is present. Initiate anticoagulation if PE is confirmed and hemoptysis is mild or stable. Consult senior team for tailored management. Remember, nurses, your job isn't just to follow orders, it's to think, which action saves this patient's life safely? Until our next video.